So with every card, we want to start with our penman. So PP is my scene safe. Is this my only patient? What was the mechanism of injury? The need for ALS backup and the need for C-spine. Then we want to get into our general impression, the level of consciousness of the patient, and what position the patient's in. So then we want to make patient contact, check for a level of response. So are you okay? Are you okay? Then we want to check for our ABC. So airway is the airway patent, and do we see equal and adequate chest rise and fall? Then we go for breathing, any oxygen interventions we want to go through. So BVM ventilations or high flow oxygen through non-rebreather mask. Then we want to go through circulation, so check pulse for rate, quality, and rhythm. And then we want to check skin signs. And then we want to decide if this patient is a high priority or low priority. Then we want to go into vital signs, so we want pulse, SpO2, blood pressure, and respiration rate. And if possible, get sample from the patient or from bystanders. Then for trauma patients, we're going to go into the secondary exam. So we're going for wound standards deformities or DCAT BTLS. So deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. So we want to go from the top of the head, side of the head, around the mouth, around the nose. Then we go to the jaw. And then we want to check for JVD or tracheal deviation. Then we want to go to the chest for equal chest rise and fall. And then palpate the chest. And then we go down to the rib cage. And then to the lower, to the abdomen. And then check the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. And then we want to go into checking the hips. So push down, push up, and push side to side. Then we want to go into the legs and push in opposite motions all the way down to the foot to check for pedal pulse and for CSM. And then we check that on the other leg. Check for pedal pulse and CSM. And then up to the arms, so check for any deformities, and then check CSM on both arms. And then we want to go in transport, and then we want to reassess vitals every 5 minutes or 15 minutes depending on patient priority.